Welcome everyone to our Guess Who panel hosted by Health Professions Week. My name is Mandy now and I'm the Executive Director of Health Professions Week. I'd like to start by saying thank you to our panelists today, each of whom we'll have a chance to meet after they've done their very best to stump you today. Here's how our guessing game is going to work. I'm going to have each of our panelists introduce themselves to you one by one. Each will have 1 minute to describe their profession without revealing their profession to you. Take good notes and make your prediction of which profession each panelist represents. When we're finished with each, I'll have them reveal to you who they really are. I will even start with a hint. Here's a list of the professions represented on our panel today. Can you guess who? Let's start with Carl. I'm going to have you go first and then we'll go down the line. So, can you stump us?
Sure. Hello, my name is Carl. I'm originally from rural Mississippi, but I currently live in the Atlanta metro area. So I'm a healthcare provider. I see patients from all walks of life, from infancy to elderly. I'm able to listen, counsel, medically treat, order labs and exams, prescribe medication, refer patients, and so much more. My profession also allows me to see patients in a variety of clinical settings, which include office visits, ER, urgent care, inpatient or hospital medicine, and so much more. To become a part of my profession, you must complete a graduate program that's at least 24 months of training. And my training is known as a generalist, so I can go into any specialty of medicine. After completing your training, you must take a certification exam to practice medicine, then apply for a state license where you're able to collaborate with many other healthcare providers.
Excellent. Thank you, Carl. Hadia, I'm going to have you go next. Can you stump us?
Hi. I require 7 years of education. During graduate school, I have up to 7 science classes in 1 semester. When I finish, I will have a doctorate degree. Depending on what school I go to, my clinicals might be over the summertime or interspersed throughout the curriculum. A residency is optional, and there are many specialties in which I can practice. In this profession, I take care of people across their lifespan. I enjoy using video games, simulations, and my hands. I work with athletes. I consult educators. I can be found working in the neonatal care unit, walking a patient on ECMO, or educating an employer about wellness activities for their employees. I am more than just a rehab specialist. I am a movement expert.
Excellent. Okay, Bradale, can you stump us?
All right, we'll see. You'll see us in a variety of healthcare settings such as hospitals, clinics, and even people's houses. You may also catch us in the sky, in helicopters and airplanes. We are involved in the care for those taking their very first breaths, their last breaths, and everywhere in between. Many of us work 12-hour shifts, days or nights. If you see us running, it is not a good sign. Our primary goal is to ensure our patients are breathing effectively. Many of our patients have acute or chronic lung issues, as well as we deal with a lot of phlegm on our daily job. In the ICU, we stabilize our patients by placing them on machines that breathe for them.
Excellent clues. Joanne, I'm going to have you go next.
All right, folks, my profession is growing. More people are studying what I learn now, and there's so much more recognition and coverage for what I do than when I graduated 20 years ago. It's a really exciting time to be in my profession. Our medical programs combine the best of traditional therapies with biomedical and diagnostic sciences. School's an intense 4 years after undergrad. Some classmates were career changers from nursing and medicine and even accounting to students like myself straight out of college. Not only did we learn from our faculty, but we supported each other a lot as well. We're partners with our patients, and we dig deep to find the root cause of what's going wrong. We have so many treatment options like nutrition, lifestyle counseling, herbs and supplements, physical medicine, acupuncture, pharmaceuticals to guide patients back to wellness. We work clinically from outpatient and independent medical practices to interprofessional settings. My colleagues also forge their own way, starting up businesses, writing, teaching, research, and consulting. Did you guess?
Excellent clues. All right, Henry, you're up. Can you stump us today?
Hi, my name is Henry Green. I'm from New Orleans, Louisiana originally. In the process of my job, I must work with a variety of clients who cannot speak for themselves but rely on observers to tell me their problems. I, and specifically, must rely on my sense of touch, sight, and especially sound in my area. It takes about 8 years to obtain the degree I have, and another 3 years of specialty training, as I must learn the dynamics related to physics of fluid flow and pump function, as well as understand how to assess and treat those. I must also be able to read images created by sight and sound and light, and also listen to rhythms, sounds created by my client to help me diagnose their problems. I must be able to clearly explain my client's diagnosis to students as well as to my client's observers, such that treatment options can be given adequately to improve my patient's life. I can work indoors, outdoors, in academic environment. A number of my colleagues start businesses, and also we can work in various industry areas. I can also research new options that may improve not only my client's quality of life, but also improve the qualities for others' treatments. Can you guess what I do?
Oh, another set of great clues. All right, we're down to the final two. Let's see if we can figure them out. TJ, I'm going to have you go next.
Okay, so after high school, for my profession, you need 8 years, 4 years of undergrad, and then 4 years, we call it for pre-doc. So in the undergrad, you have multiple specialties. You can choose many things. For me, I did in UMass, so I studied biology. And then in the pre-doc, we start with anatomy, physiology, and biochemistry. And later on, from the second, third, and fourth year, it's mostly clinical practice. In my profession, what we do is that we treat pain, we restore function, and we provide aesthetics. So, guess.
Excellent. And Muriel, last set of clues.
All right. So I'm originally from Central America, and I was transplanted to New Orleans, where my family lives. Now I reside in Houston. I have the ability to see patients of all ages, but my specialty and passion are small children, children with special needs, and patients with traumatic brain injuries. I take care of one very specific critical organ. The majority of the time, I spend obtaining objective data from my patients. This is information that doesn't require them to say very much, but through play and creative and appropriate testing, I'm able to determine many diagnoses and treatments. My profession allows me to be very flexible. I'm able to practice at the university as a professor and also in a private practice. It took me 4 years of undergraduate studies. I did biology, chemistry, and then 4 additional years plus 1 year of residency to complete my doctorate. You also have to take board certification exams to practice. Can you guess?
Excellent clues. Oh my gosh. Now we have to go through and see if we can't figure out who our panelists really are. Carl, would you like to share with us who you are?
Yes, I am a certified physician assistant.
Yay! I hope everybody got that one. Fantastic. Hadia, will you share with us who you really are?
I am a doctor of physical therapy.
Wonderful. Thank you for being here. Bridale, who are you?
I'm a registered respiratory therapist.
Wonderful. Joanne, who are you?
Dr. Yanez, and I'm a naturopathic physician.
Nice. Henry, who are you? A veterinary cardiologist. You can't read that, folks. That's what his sign says. Nice. Very cool, Dr. Green. TJ, who are you?
Dentist.
Dentist. Wonderful. And Muriel, who are you?
I am an optometrist.
Woo! Fantastic. This is great. Thank you. You guys did an awesome job trying to stump our audience today. Okay, now that we know who you really are, let's take a moment and describe some of the key highlights about your profession. What makes your profession unique? And we're going to mix it up a little bit, and we're going to start with Muriel. We'll go the other way down the panel this time.
All right, yes. So there are many things that I love about my profession, but I'll try to share the most significant ones. I love how versatile the profession is. You can work in a hospital, you can work at a university, you can work in a private practice, you can specialize in different areas like how I specialize in special needs and brain injury patients. And so you aren't conformed to just one way of practicing. The profession is always doing cutting edge discoveries and treatments, so it's definitely exciting to be in this right now. Another super plus that might interest you is that it allows for a manageable work-life balance. If you'd like to start a family and work part-time, you certainly can do this with this career. If you have some hobbies like dancing salsa, which I do, you can also do that after hours. The profession of optometry is very rewarding because you can immediately see patients' satisfactions when they can finally see. When they finally get their first pair of glasses and see the leaves on the trees, all you blind people out there know what I'm talking about. Or when they can finally see their mom's face for the first time. It is so impactful to see that. I'm sure you guys have seen those videos. So it makes me feel really good inside. I feel like I want to relive that over and over and over. So because optometry offers so many options in a variety of practice modes, I feel it's a great choice for many people as we all have different wants and needs. It's definitely has not disappointed.
Wonderful. Thank you for that description. TJ, can you share with us a little bit about dentistry?
So if you would like to serve the community, so for example, the patients that come to us, mostly they have pain in their teeth. Some of them, they come to restore, like, some aesthetic, someone lost a tooth or something. So when you relieve them of their pain, or you fix a tooth, or you fix their smile, I mean, the reaction as that you get, it's so meaningful. It's amazing. It's rewarding itself, other than everything else. But other than that, also in our field, you can also specialize in 8 different specialties. For example, me, I'm doing in prosthodontics, where we do oral mouth rehabilitations, where we're fixing the whole mouth. And other than that, you can also specialize in pediatric dentistry, where you treat kids, which is also an amazing specialty because you're so close to the kids. You can even find signs of abuse if any kid is getting abused or not. I wanted to mention this point especially. So there are so many opportunities in dentistry. Like, if you come and join in, the world doesn't, the sky is not even the limit, you will go beyond that.
Excellent, thank you. Henry, how about veterinary medicine?
Veterinary medicine is a wonderful profession. It is a profession that ranges the gambit of opportunities. I can travel the world. I've been all over the place as my profession has taken me to places like Japan, to Europe, others to China, to Africa. You can work on a variety of species, ranging from the smallest little creature that you could find to something as exotic as elephants and tigers and giraffes. You have the options of working in a number of settings like industry. You can build your own practice. You can work in academia as I do. You can specialize in a number of different areas. My specialty is cardiology. And most people are shocked to find that veterinary medicine has the range of specialties that human medicine has. Veterinary medicine not only affects the healthcare of animals, but also affects the environment and also affects human interactions and human life as well. As we do a lot of preventative medicine, we can do research that ranges from assessing for vaccine function, all the way to creating treatments for heart disease, such as stent models and interventional procedures like I do. And specific to me, what makes me enjoy my profession is the daily basis giving back an owner their animal and seeing their faces light up, seeing that their patient or their animal and their baby essentially is feeling better than it was when it came, hopefully. So there's a number of things that we can do, including teaching, and it's just a wonderful profession, as well as it gives you work-life balance. I coach on the side, so that's one of the things I also get to do outside of doing my profession, teaching. So it's a wonderful range of things you can do, and it's an exciting profession that can take you places you never thought you would go.
Wonderful. Thank you so much. Joanne, tell us a little bit about naturopathic medicine.
Sure thing. One of the things that so many that go into the naturopathic field we hear is that they're drawn to passion, they're drawn to a career that aligns with their philosophical beliefs, their own personal wellness practices, and really wanting to develop a deeper relationship with patients. And so NDs, something not everybody knows, is we will take at least an hour to an hour and a half with our first office visit. And so because we're sitting so long with folks, we're really trying to get to the root of the issue to underscore what is causing this. So let's say you have a headache or you've got some other illness going on, the ND is going to work with you to understand why it's showing up, not just give you something to make it go away and feel better, but really understand the why. And so when you can get to a patient and help them get rid of something that has bothered them for years. We've had patients I've seen with eczema, with chronic stress and anxiety and insomnia, that those things go away when you get to the cause of it. There really isn't too much more satisfying. And so I love, though, what I also love is the flexibility that we see. So I'm an advanced career professional, and we've got folks, that's a way of saying I'm old. We have folks who mid-cycle, they say, you know, I don't want to see patients full-time anymore, or my kids are out of the house, I want to travel. And so they can, with the same degree and not having to, go back to school or anything like that, really change focus and have some flexibility to go and do something different, or write or teach or do research or consult. And so I love that flexibility that I see my colleagues enjoying.
Wonderful. Thank you so much. Bradale, want to tell us a little bit about respiratory care?
Sure. I feel like respiratory care is a great field for those who like to be a part of teams as well as help others. And once again, you can show up in a variety of places and locations. So if you're like myself, I live and I work in Chicago. You can be a part of a big medical center, work in the ER, attend high-risk deliveries for premature infants, and be on transport teams and be high in the sky. Or if you want something that's a little slower paced, you can be at a community hospital, a long-term care facility, or even a pulmonary function testing lab. If you want something even slower than that, you can pop up in home health, sleep lab, or even hyperbaric oxygen therapy. There's so many different opportunities for growth, I feel, with respiratory care. It's a great springboard if you want to move on to another career, or just move throughout the different phases of respiratory care in terms of the different modalities and things we do with patients. You can do, once again, transport team. We work ECMO machines, which is, for those who may not know, it's like a heart and lung bypass machine in the ICU. We're involved in research. We're also involved in education. And like myself, I'm now a clinical coordinator. I've kind of taken the administrative route, and you can become an administrator. It's a really specialized field, and I feel like you're really sought after, valued, and you have such a specific knowledge that's relevant to a patient's health and comfort. And you're truly the expert. By the end of your program, you're truly the expert, and you know everything that you need to know.
Thank you so much. Hadia, how about physical therapy?
So as a physical therapist, we consider ourselves movement experts. And I think what is synonymous with a lot of the professionals on this call is that we consider ourselves quite diverse, right? So we're thinking of movement not just in terms of your physical body, but your physiological. So whether that means your blood and increasing your circulation, or your joints, or your actual functional activities, which is more of a line what people may have think about physical therapists. I think the nature of our work is very giving to the patient, as well as the rapport that you can develop with your patient, because like the ND, we spend about an hour for evaluations with our patient, and we typically see patients more than once a week. Even if it's only once a week, it's usually weekly during an episode of care, if not in the primary care setting, where that would be across the lifespan. So you have an opportunity to develop a rapport that you don't typically get when you meet with a professional who you may only have 15 minutes with. And that lends itself to actually getting to the roots of problems. And like was stated before, so we're going beyond the symptom and actually trying to address the problem. And that is very rewarding. In addition to being an expert in rehabilitation and habilitation, which people typically think of as physical therapists, we work in the spaces of prevention, health promotion, and wellness, which includes sports, research, even the cardiac ICU. And it really has been a great opportunity for someone like myself, who has been in every setting, from early intervention with 0 to 3-year-olds to working at Mayo Clinic in the sports and pediatric setting, to working at sporting events, and now at the association on a professional, administrative, and research level.
Wonderful, thank you. And Carl, how about becoming a physician assistant?
I always say that becoming a physician assistant saved my life, and I will tell you why. So the PA profession is a second career for me and many individuals who are PAs. A lot of my classmates were nurses, respiratory therapists, paramedics. So it's definitely a method to, provide another method to provide services to the community and to your patients. So I specifically worked in medical oncology. When I graduated from PA school, we don't specialize with trainers generally, so we can go into any specialty we want to. So you have individuals who do family medicine, you have individuals who do internal medicine, you have people who do critical care. So we have the opportunity to be trained in school and on the job training to become experts in our particular field. So when I became a medical oncology PA, I was able to provide service to those patients who felt their voice wasn't being heard. I was able to spend that time. I was able to collaborate with other healthcare providers, as many individuals on this panel. I was able to connect with naturopathic medicine because we utilize those services quite a bit. We were able to connect with physical therapy. We were able to connect with respiratory therapists. We were able to connect with everyone because our ultimate goal is to make sure that we provide quality, high care to the patients. And the reason why I say that the PA profession saved my life, because when I was in a dark space, a PA took her time out of her schedule to talk to me and bring me back toward the light. And that was the motivation that inspired me to transition from what I was doing before. I was have a doctorate in pathology, doing biomedical research, to become a physician assistant. So that's what makes the physician assistant career great. You have a lot of flexibility, you have the work-life balance, and you ultimately get to provide the care to the patients that you ultimately seek to do. I love it, and I appreciate everybody on the panel, because each one of you played a key role to become the PA I am today.
Wow, that is incredible. Thank you, everyone, for sharing today. I do have 2 follow-up questions, so we'll take them one at a time. Anybody is welcome to answer. First question, what led you to your career in healthcare? And Carl, I think you have nailed the answer on that one. So thank you for sharing. But if you have other thoughts, we welcome those. Anybody else want to talk about their path? Joanne.
Sure. So I was one of those kids that I always wanted to be a doctor. And I thought I was going to be a psychiatrist. And through the personal exposure to other methods of healing, my own dad had cancer. And the only thing that brought remission was natural medicine. And so in the back of my head, I always knew that there were additional ways of healing, not that any one way was wrong, but I knew that. And so throughout the course of undergrad, I was searching and it just didn't feel right. And I know that, some people may also vibrate with that, and they may feel the same, like, oh, I thought I was going to do this, and it just didn't feel right. And so I finally, I went to speak to, my mom had been bugging me. She's like, go talk to this doctor, go talk to him, he'll help you. I'm like, yeah, you know how we don't listen to our parents sometimes. And so finally I called him up, and he said, if I had to do it over again, I would be a naturopath. And I said, a natural what? And and he told me about getting to the root cause and using acupuncture and using physical medicine and using mind body medicine and nutrition and lifestyle counseling and all of that. I'm like, oh my goodness, like literally the light bulb went off for me. And I hear that story so many times from my colleagues, where it's just like this light bulb goes off for you when you find that thing that's your thing. And so since I've combined my loves of education and advocacy all into this career that I love, but it really is about finding that thing for you.
Thank you, Jo. Hadia, did I see you raise your hand? Yeah.
All right, so I would say what led me in originally, I, like Joanne said, I want to be a pediatrician from the time I was little. At 12 years old, I had a sibling born traumatically who required physical therapy at home. And I was opened up to the idea of a profession I never encountered before. And I decided I loved the part where they taught us as family members to work with him hands-on and do exercises with his little tiny body that I loved working with my hands. And it was the click to me. And I was like, in my mind as a little child, I was like, well, doctors give people medicine, and I prefer not to give people medicine. I would like to do this hands-on. As I got older in high school, I had the opportunity of shadowing my athletic trainer, and he had the foresight that I didn't. When I really was looking to go to college and do athletic training, he was like, well, why don't you think about physical therapy? And I have been thoroughly pleased with my choice of profession and the flexibility that it's allowed me to do.
Thank you. Henry, I think I saw you raise your hand. Did you want to answer?
Yes, so I, like I said, I'm from New Orleans, Louisiana originally, and grew up in the Ninth Ward of New Orleans, not having very many animals nor veterinary examples around me. Through a series of events that were fortunate enough, I had to switch schools from 5th grade to 6th grade, go across town to another school, and the teacher stopped and asked us a career choice of what we wanted to do. Two of them were things that I probably could never do based on my size. One was being a professional football player. The other one was a jockey. But the other thing I wanted to do that was consistent in 6th grade was veterinary medicine. And the reason it started out was because I would follow my grandmother, who raised German Shepherds, to the veterinarian. And I just loved his interaction with her and how he treated her German Shepherds, that she bred those. And I was always hanging around her and loved those animals. And so I would always had that in the back of my head. And my parents to this day were trying to figure out where did veterinary medicine come in. And I would explain to them, Mama took me to the veterinarian with her. And that's how I started getting introduced to the profession. And through a number of other challenges where people told me that you could not make it, including counselors. And counselors in college told me I would never get into veterinary school. I persevered. I was a college athlete, so I didn't have a lot of time to actually go and get veterinary experience. So that was one of the reasons they said you would never get into vet school. Well, lo and behold, they were right. I didn't get into Kansas State University, which was one of the schools I applied to, and a number of other universities. Louisiana State opened up a door, and I walked in and had a number of opportunities presented to me, which included also going to Washington State University to perform in cardiovascular research, which is how I obtained an interest in cardiology. So my advice to any student is to walk through doors that you want to open, and if they can't open, bust them down for yourself.
Nice. Yes. 100%. Yes. Yeah, Muriel, absolutely. Please.
Yeah, so, I feel the passion with Henry, because I mentioned earlier how I come from a Central America. So I come from a really poor country. And I remember not wanting to eat my vegetables, you know, y'all can relate to that. And my dad saying, okay, this week, we're not gonna let the trash people collect our trash. We're gonna go dump it out, you know? So I was like, okay, you know, whatever. So sure enough, Saturday comes along and he gets in his truck and he's like, come on, let's go dump our own trash to the dumpster site outside the city. And he took me to the dumpster site and I saw this little boy jump on the bed of the truck to dig food in my trash. And so that moment I was like, I need to help these little kids. I need to help kids. I was like, I'm gonna be a pediatrician and I'm gonna go do missions and help all these kids. And so then for the kids that are listening, coming to this country as an immigrant is very difficult. And like Dr. Henry was saying, you have to bust doors open because the doors are gonna be closed for you. So if you really want something, you have to persevere. You can't give up. You have to persevere. And so in undergrad, I wasn't sure. I knew I was going to be a doctor from the moment I took that trip to the dumpster site. I'm going to be a doctor. I'm going to help kids. And so through a series of events, I ended up in optometry, and I realized that I can help kids in this way as well. Okay, so I see special needs children, and those kids are so special to me because they can't speak for themselves. So I am their voice. I speak for them. They need glasses. I can tell if they've been abused. I have to report that stuff. I am their voice. So that's how I ended up in optometry. But I think the overall message that you guys will hear today is that all of us love our career and we love to help. Like, we love to help. And that's my story.
Oh,
So,
Miriam.
Mandy, if I can just jump in and
then Carl next.
I think I'm not going to speak for all of us, but I would venture a guess that probably all of us at some point have been told no, and no, you're not good enough, and no, you can't, whether it's because you're a female or the color of your skin or your background or you know where you came from. And so I always tell folks, write down your why. Write down why you are motivated to do this, because somebody along the way is going to try and knock you down. They're going to try and bust your confidence. They're going to try and make you question yourself and doubt yourself, whether it's an exam in school or a counselor or a family member. Somebody along the way is going to try and knock you off path. And so keep that why somewhere. Keep it really, somewhere safe that you can pull that out when you're questioning yourself and you're doubtful, so that you can remind yourself and stay on track, because at the end of the day, you keep yourself on track. Those other folks don't matter.
Absolutely. Carl?
I wholeheartedly agree with that. I remember, like I said, I'm from rural Mississippi. I remember being a senior in high school and one of the graduates coming back and telling me, oh, you going to that school, you're going to fail out. You're not going to make it. You're not going to do well. And had I just focused on those words, I wouldn't be where I am today. So I will always tell people to tell yourself that you got this. Whatever obstacle is in your path, remember, is only an obstacle you can get around it to get to your ultimate goal. You got this. You keep pushing. I will always go back to when I was doing my PhD work. During the middle of all that, my mother was diagnosed with stage 4 pancreatic cancer. And the individuals I was working with, they couldn't comprehend that. They couldn't comprehend it at all. And they started doubting my ability. Had I listened to them, I wouldn't have the courage to finish up the work I did do and pursue a career that was much more rewarding for me. So you will have those naysayers that come and tell you that you won't be able to do this, you won't be successful. But always remember, what's meant for you will be for you, and you will be successful. So keep pushing to your goals. Remember your why, and you will be successful. Thank you.
Absolutely. Absolutely. Bradell, did you want to add
I
a thought, please?
can add something. So my advice would be to not be afraid to try something new, because I wasn't 5 years old saying I want to be a registered respiratory therapist. I had no idea what that was up until I was maybe 18 or 19 while attending the University of Missouri. Go Tigers! But take advantage of those health fairs or the career fairs. I happened to take intro to health professions class, and literally every program director for a healthcare program on Mizzou's campus came through and gave us amazing lectures on who they are, what they do, and where you would find them. And I learned so much about so many different things, and I was able to tailor my experience to what I really wanted it to be, in a sense. So I would say, don't be afraid to go out on a limb and try something new. Join a growing profession, whether it's RT or sonography, speech language pathology, nuclear medicine. There's so many different things out there. You don't have to just, stay in the mainstream, because many of us wanted to be doctors, many of us wanted to be nurses, many of us saw us doing something very mainstream, but, kind of cutting away from the fray and doing something different. There's nothing wrong with that. And you can still make as much change and have as much great of an impression on others by doing something different.
Excellent. Henry, bring us home on this question.
I just wanted to add in, don't forget the people who are your structures, who are your backbone, that will help open those doors and help you bust down those doors. There's always someone. None of us got to where we are by ourselves. So there are always some people that very much helped us, like our parents, friends, strangers, that helped us get along, keep us on the right path to doing what we're supposed to do. So stay the course.
Yep. TJ, one last thought.
So I loved how the panel covered all the aspects of the profession. I would just like to add the financial part. So as you know, the high school students are going to hear this. So for me, it was a big issue. So my dad, he lost his job early, so I had to work. So what I did is that when I was in the dental school, because right now I'm a resident, so I used to work in a restaurant as a waiter. And then I was working at another place to clean. And then I got a job in my own dental school to clean all the floors. So the thing is, but nothing stopped me. As Dr. Henry said, break all the doors down. So don't let the financial part stop you, because after I graduated, all the money that I had spent in 8 years, I made it in 1 year. So I want the people to know, when we say 8 years, people say, oh my God, I'm going to spend maybe $500,000, $1 million, but it's okay. Don't worry. It's the investment in your own future. So if you like the specialty, go ahead and don't be afraid of anything.
Excellent advice. Yes. Okay, I have one more question for this panel. So we're 2020, currently sitting in the middle of a global health crisis, pandemic. How has COVID-19 impacted you as a professional? Bradell, I hate to, call on you first, but let's hear from you. So, respiratory therapists, you've been in the news a lot lately. What's going on?
So there's only 140,000 of us in the United States of America currently. So we are a growing field. So sometimes you feel like the underdog, but now that we're getting a little bit of shine, it feels kind of good. But in terms of working with patients, working in medical centers where COVID-19 is kind of running rampant, especially in being in a metropolitan hospital here in Chicago, you definitely see the devastating effects when you're not only under a stay-at-home order and you're considered essential and you're still trying to stay as normal as possible and commuting to work and working your 12 hours, but also noticing that you're caring for patients who no longer are able to have their family members come and visit them. And a lot of people already think this way, but you're their family member while they're there, and you're treating them with the utmost respect, and you're giving them so much love because you want them to get better. But it really does have its ups and its downs, and it does have its stressors. being inundated with a large amount of just ventilators. But I think on the opposite end, you're seeing so many people opening up their hearts, and you're seeing such an outpouring of love and light coming from so many different directions, whether it be a donation of PPE or food for the day from a local restaurant. It's affected me a lot of ways, professionally and personally, but I think the best part about this is you're getting to see the best in others during some of the worst times, and just knowing that it will get better as long as we band together and we stay strong, that everything will be okay.
Thank you. Joanna, oh, I think I saw you raise your hand too.
I did. Working in healthcare education, coronavirus has really upended just about everything. And I think, I know with my colleagues, I've been working harder than I ever have, even as a resident. Like this has taken the workload. Plus, like many out there, my colleagues and I have been working really hard for continuity of medical education for our students, to make sure that they continue their goals and their dreams, continuity care for thousands of naturopathic patients at our academic and community centers. And like many out there, I'm balancing childcare. My mom was diagnosed and went through another cancer surgery in the middle of this, and social unrest that's going on. My husband's a hospital administrator, so he's been working insane hours. And by necessity, it reminded me of my naturopathic training. And I said, okay, I gotta take care of myself. If I'm falling apart, my neck is hurting from being at the computer, I'm getting headaches, I'm, stressed out. I need to focus on me. Otherwise I'm no good for anyone else. And so I was thankful for that training that I had, that physician heal yourself first, put your own mask on before you put the mask on someone else. And so I had to remember that for myself in the midst of all of this, because I knew I was going to be no good for anyone if I didn't focus a little bit on me and take care of myself.
Thank you very much for that. TJ, tell us a little bit about what's going on with you in your world.
The COVID-19, it showed me a new side of dentistry, so that I never knew before. So during this COVID-19 times, I started to realize that there are some people, married people or partners, they're living together and they did not even inform their partner that they have fake teeth or stuff. So I started to get phone calls in the night and stuff, and they literally were telling me that I lost a tooth and my husband is at the home all the time, or my wife is at the home. I really need you to see me today urgently as possible. So I get to see something that I never knew before, and we helped those patients, but I'm not joking, but the number is really high of people like this. So we helped a lot of patients like these. They had urgent calls. I literally had to go one day at 4 a.m., sometimes at 2 a.m. The lady, she dropped the denture in the toilet, and then she said, look, my husband doesn't even know that I have fake teeth. So please, can you guys fix it right now? So we said, of course, yeah, definitely. So yeah, COVID-19 has affected us in a good and bad way, but sometimes in your own profession, you see things that you get to learn that you might not learn in another ordinary time.
Hadia, go ahead.
So at the association level, it has been an extreme increase in hours of output of information on the coronavirus, as we have colleagues who are furloughed or completely let go. And then we had the handful of therapists who were continuing to work in the space and trying to figure out, how do I work as safely as possible, but still continue to work with those individuals who need care. There was a huge increase in the services in the area of telehealth for physical therapy, which is something that I think people don't typically know that we do. And from an advocacy standpoint, we weren't allowed to do it and be paid, right? So it was something that's in our scope of professional practice, but it wasn't necessarily something that CMS, who does Medicare, or third-party payer insurances would pay for. And so that was the hugest change, and something we've been working on for probably over a decade, that instantly was changed because of the coronavirus and the need for people to stay at home but still receive much needed care, and which also helped to keep people out of the hospital systems that were already being over flooded by those who needed the care of specialists like on this panel, who actually needed the coronavirus intervention more immediately.
Thank you very much. Henry, did you have an impact
Yeah,
that
so coronavirus has affected veterinary medicine in a number of ways, and most of our clients don't have to pay for care of their animals, and they still love their animals. So a number of animals can't receive health care because clients have been they're laid off of work. We've had to take specialty precautions because of the connections between cats and coronavirus for us. It's affected the educational industry in that we've had to use a lot more technology to educate our students, and especially in the clinical year, that's been very difficult because students have not been allowed in our veterinary teaching hospitals in a number of universities. So there have been a number of different avenues to fix those educational flaws where students can't get that hands-on learning. I've had colleagues laid off of work from private practice because if they don't see cases, then they can't afford to pay the doctors. And then we've all seen the industry affect us. We shop. Prices have gone up because of care for animals out in the field. They're not being purchased, so prices go up. Supply versus demand issues. That also affects veterinary industry as far as herd health is concerned. So it's been a across the board effect. We've also seen a ramp up in research. We have my own dean here is a virologist, a veterinary virologist, and who actually did his research, PhD in COVID, in the COVID virus. So, you know, research in those areas to help create the vaccine has gone up with animal models and things like that. So it has affected our profession in a number of different avenues.
Ariel, yes.
Yeah, so just to kind of echo what Henry and Joanne have said, because I think all three of us are somehow in the academic realms as well, and so is Carl. And so it has definitely changed the way that we teach our students, kind of like how it has affected high school students as well. And so we want our students to be the best, and we are trying to be innovative and change things around, and how can we keep them engaged? And really nothing replaces this hands-on experience that they get through their clinicals. And so that's something that we've also been struggling with at the university level, and we're slowly trying to get back into some kind of normal. I've also, because I work private practice on the weekends or some weekends, I had that practice was closed for a month or so, but I was lucky enough to be able to have my academic career where I am full time and not suffer a financial loss in that aspect. I told the owner of the practice, hey, I know you have doctors there because we're a multi-doctor practice and I'm their kids specialist. I told them, you know, I don't need to come back anytime soon. I'm okay with you getting your practice up, and when you're ready for me to come back, I'll come back, because I know some of those doctors were out of a job for a month.
Yeah. All right, everybody. Thank you. I think that's all the time we're going to have for today. And I want to thank those that are watching for playing Guess Who with us today. Did we stump you? Did you learn something about a new profession that you didn't consider yet? I am going to share one last screen with you guys today while I say thank you to our panelists for being here today. If you have any, go back, there we go. If you have any questions or you want to follow up with any of the professionals that you've met today, you can reach out to me at Health Professions Week at healthprofessionsweek@gmail.com, and I will happily connect you with these or other staff who can help you learn more about careers in the health professions. I also want to encourage all of you to keep exploring careers. Here at Health Professions Week, we have lots of resources to help you explore careers confidently. Learn more and register for our next event at explorehealthcareers.org/HPW. We'll see you all in November. And again, a round of applause for our panelists today. Thank you so very much.